Good evening. Today is May 6, 2020, and it is 5:30 p.m. As a quorum of the board is in attendance via our video conference link, I would like to call to order this special call meeting of the Central Health Board of Managers. For the members of the public joining us this evening, I want to note that technical and security issues have prevented us from offering video conferencing functionality to the public. Members of the public may only participate through audio for this meeting. The recorded audio and video stream from this meeting will be posted on the Central Health website as soon as possible after the meeting concludes. If any member of the public is having difficulties joining the call, use of the 888-501-0031 number, please refer to the posted meeting agenda and try one of the additional numbers listed at the bottom of the notice. The first item of business is public communication. Yvonne Davila of the Central Health Communication Department will briefly cover the guidelines for the public communication portion of the meeting and will then introduce all commenters by name and invite them to speak in turn. Yvonne?
Madam Chair, there are no members of the public who have signed up to speak for this evening public communication.
Okay, thank you, Yvonne. Given that there are no members of the public who have signed up to speak during public communication, we will now proceed to the regular agenda. Item 1 of the regular agenda, receive and discuss updates on the Central Health Enterprise's responses to the current COVID-19 pandemic, including changes in healthcare and administrative operations, coordination with local disaster response efforts, data from community care testing sites, and related fiscal issues. Members, I ask that you please hold your comments till the end. This is very important because I understand that we will lose a quorum of this meeting at 6:30 p.m., so we need to conclude the meeting at 6:30 p.m. this evening. Speaking on this item will be Mike Giesland, Ted Burton, Kit Abney Spells, Sarita Clark Leach, and Jason Fournier. Let's proceed, please.
Madam Chair, before you start,
yes.
I'd like to ask when the presentation will be available. And if it's not, or if the public cannot witness our virtual meeting or video conferencing, then can we post the presentations in the complete packet prior to the meeting so they can access it on the Central Health website?
I do not know the,
I can respond to that.
Okay.
The presentation, the Central Health presentation has been uploaded to the internet, to the Central Health website. Community Care's website will be uploaded as soon as we receive it tonight.
Thank you, Pearl. Let's proceed and hold all questions till the end of the presentation. Thank you, Manager Valadez. Important question. Proceed, please. Mr. Giesland?
Good evening, members. This is Mike. Yes, this is Mike Giesland. Can you hear me?
Yeah, Mike. All right, hold on.
Yes, we can hear you.
Hey,
right,
Frank,
thank
how are
you.
you? So we saw me that
If we could ask others to mute their phones.
Everyone, please please mute your mics if you are not speaking. We're getting feedback.
Thank you very much. Members, thank you for your time this evening. I'll be brief. One is an operational report. Two is community response. On the operational report, we are still at a business continuity plan level 3, meaning full remote working. This is in effect until 22 May. After that time, we will have a very controlled set of permissions that allow people to come on site and work if their job requires it, or if there is the need to have an on-site meeting. So as a background rule, after 22nd May, for the most part, everybody will still be encouraged and asked to work from home if at all possible. But if that is not possible, then we'll have very controlled circumstances at which people can come into the office to have whatever meetings or perform whatever duties they need to perform. And while mission fulfillment is our priority, our concurrent and equal important priority is employee health and safety. And we'll be discussing these plans through executives with employee groups and departments and teams next week to get some feedback to make sure that we've covered all of our bases. And then we'll have more standard operating.
Mr. Giesland, are you still speaking? We lost you there.
Yes, I'm sorry. I probably went into a dead zone. Can you hear
Okay.
me now?
Yes.
Okay. So with respect to the community response, where we are right now is there is data that shows that the hospitalizations, while they picked up a little bit, it still is at a very, very manageable level. However, those numbers don't tell the full story. And I'm proud to say that with Community Care's testing efforts in Eastern Travis County, we are getting the information that we need, especially along demographic lines, to be able to tell us what is actually happening. So while the averages paint a very manageable picture, and what Jason will talk about later is very disturbing trends among various demographic groups. So I'm very proud that we're partnered with Community Care, that they're out there doing this testing, and I want to commend everybody on that side of the house for everything that they've done, but also on the communication side for Central Health, helping to promote the testing services that are available. Next, as I see this, we are preparing for 2 surges beyond where we are now. And I'm using that term loosely because there's hospital surge capacity, but I'm talking about infection rates and then along with that, hospitalizations. And so because we've opened up as a community, we're starting to open up businesses, we're relaxing social distancing, we're going to have an increase in cases this summer. And then if we are able to move fast enough as a community, and this is not a Central Health controlled effort, this is a community-wide effort, to be able to bring back social distancing, then we can keep that, we can push those numbers back down, but then you'll start to see another surge again later in the fall. So that's what we are preparing for, both operationally as an employer, but also as an organization that is absolutely critical as an enterprise to the health of this community. So those are a perspective on my part, and obviously we're watching these numbers and things change day by day and week by week, but I wanted to provide that for the board's consideration. End of report. I hand it off to Ted.
Thank you. Next, please. Thank you.
This is Ted Burton. I'm Vice President of Communications at Central Health. Can you hear me?
Yes, we can hear you. Proceed. Thank you,
Great.
Ted.
Thank you so much. So at previous meetings, we've talked about our comprehensive communications and community engagement and outreach efforts. Tonight, I'm going to focus specifically on our COVID-19 radio awareness campaign. This was a 5-week campaign that started on April 10th. The target audience is Travis County residents 200% or below the federal poverty level. We also looked at people who are uninsured, MAP members, and people who are insured through the health insurance marketplace. We also added into our target audience people who may have been recently unemployed due to COVID-19 and who may qualify for MAP. This particular media initiative was weighted more heavily on the Spanish-speaking audience, focusing on 20 to 39-year-olds approximately. And you can see there the list of stations that we advertised on. I won't read those to you, but it's a mix of Spanish language stations and English language stations, R&B, and adult contemporary. Next slide, please. The messages are messages that we've been pushing very hard through all of our channels and in our one-on-one outreach and community engagement. It includes messages about the COVID-19 hotline, the drive-up testing sites, locations, hours, criteria, pushing our telemedicine or medical appointments by phone, MAP applications, which can now be done online and of course over the phone, pharmacy services, and then the stay home, stay safe message and our new texting platform. We used 15-second radio ads. We used live DJ reads, digital streaming, and we also were able to layer in there in-person interviews, both in English and Spanish, with our staff that have run multiple times a week on various stations. And I do want to thank our media partner, Cultural Strategies. They've been a longtime partner of Central Health, and I'm really grateful for them turning around this radio buy so quickly for us. Finally, just to give you a quick recap of the results, this was a 5-week buy starting April 10th. We're going to continue this buy. We're in the process of updating the campaign itself. We aired 459 spots a week, and we reached nearly 500,000 people in the Austin metro area. 28% of the Austin market heard our spots. More importantly is that nearly 66% of our target audience heard our spots multiple times every week, actually 5 times each week. So that's a quick update on just the radio component of our media campaign. I think the data you'll hear from Community Care will indicate that our messaging and our penetration is working, just based on some of the testing data that CUC has been reporting from all of their drive-up testing sites. And with that, I will pause.
Thank you. Next presentation, please.
Good morning, managers. I'm Kit Abney-Spells, Senior Director of Eligibility Services, and this is your weekly recap of MAP applications, MAP and MAP basic applications, as well as the enrollment. As you can see on the slide, in the month of April, we saw a slight dip in the number of applications received compared to the month of March. But I wanted to be sure and sort of remind folks of the coverage extensions, and you can see that in the month of April, there would have been 7,400 individuals whose MAP or MAP Basic would have expired and would normally be reapplying. So I think if we had not done those coverage extensions, we would have seen quite a bit of an increase in the number of applications received for the month. We are still sort of tracking our phone applications. That still seems to be the way the majority of our applicants are applying. But over the last week, we did see an increase in the online applications. So as of Sunday, we had 605 households apply online, which represented 743 individuals. And I've sort of given you the top zip codes, but we've seen the applications coming from 59 different zip codes in the Travis County area. And then lastly, you can just see that our overall MAP and MAP Basic enrollment continues to rise. And that concludes my presentation.
Thank you. Next presentation, please.
Hi, can you hear me?
Yes, thank you.
This is Sarita Clark-Leach, Director of Analytics and Reporting for Central Health. And this is, again, a follow-up of the trends we've been monitoring over the last few weeks. And from a Travis County-wide perspective, you'll see that doubling time has, it's slightly increased, which means that the rate of infection is still growing, but it's increasing at a slower rate than it was in the previous week. However, we should continue to monitor that, as Mike indicated, as there may be an uptick in growth relative to the relaxing of the social distancing measures. And again, looking at the per capita incidence rates, you'll note that the same counties are experiencing growth. The same zip codes are experiencing growth. And some new areas that have popped up on our radar are MLK, which is zip code 78721, and Runberg, in that they're showing that their doubling time is actually shortening. So areas to continue to monitor. Next. And here's just a graphic of that change in the number of cases. So essentially new cases that are being added each week in each of these zip codes that we're looking at currently. And you can review those as they're on the presentation. I won't go into detail, but you've seen these codes before. Next. And these are the trends for the population of confirmed cases by race. And again, you'll see that, that there haven't been really any big changes in regard to race from last week to this week, or even in the previous weeks. And next. However, when you look at the confirmed cases by ethnicity, you'll notice that this is the first week that we've seen the Hispanic population eclipse the non-Hispanic in terms of the proportion of the population who are infected with COVID. And next. Thank you.
Thank you. Let's proceed with the next presentation. Do we have another presentation?
Manager Greenberg, or
Yes.
Madam Chairperson, yeah, it's Jason here. I'm going to
Yes.
go ahead and share our my screen here with
Thank
you.
you. Thank you. Thank you for being here. We know how busy you are. We appreciate what you're doing.
Yeah, no problem. I've also got our Chief Operating Officer, Yvonne Camarena,
Yes.
in the room with me. I'm just upping the Zoom so you can see us. So, Madam Chairperson.
Well, we appreciate your time too. Thank you so much. Yes, Jason, please continue.
Yeah, well, thank you so much. Really looking forward to providing you an update this evening. And so just very quickly, oh, slides do not seem to want to move. I apologize. There we go. So I'm going to ask Yvonne just to talk a little bit about our testing initiative in the Eastern Crescent. So Yvonne, please.
Yes. Hello, everyone. Thank you for giving me the opportunity to discuss our continued good work in the Eastern Crescent. As you know, over the last couple of weeks, we had the opportunity to partner with the Austin Colony Homeowners Association to provide testing in the Hornsby Bend community. We also, and you can see by the slides that we did have an effective impact in the number of individuals that were tested not only in Hornsby Bend, but in our other Eastern Crescent locations. The important transition that we completed this week on Tuesday was that we moved our testing location to the Hornsby Dunlap Elementary School that's off of FM 969. The team was able to transition. They set up at 8 o'clock in the morning at the site, and by 10 they were open and ready for testing at the new site location. We appreciated the partnership with Dove Valley ISD that helped shepherd the opportunity at the elementary school. It's a very good location for us. We're under a covered awning, which is very helpful, obviously, as summer starts to come upon us, and to help the team that's out there in the PPE that they have. So we continue our other locations as far as at Barbara Jordan on Mondays and Fridays, as well as our Manor High School site, and then obviously on Thursdays we continue at Southeast Metropolitan Park for our Dove Valley location. And you can see in the slides just the number of individuals that we are reaching related to our testing efforts. And so we continue to have these services ongoing, and we will continue to serve the population from 9 to 4 at our routine schedule.
And I think what's of important note to the Board of Managers, in less than 2.5 weeks through Yvonne's team and others that are participating and helping in certainly Central Health and Ted and the communications team getting the crowd. We've actually seen 403 unique individuals on sites and tested 303 unique individuals. So a very important testing initiative as it relates to Eastern Travis County. As we updated you before, we wanted to highlight that change relative to Austin's Colony based on community feedback. On this particular slide, this is just our run rate relative to Hancock last week. I remember, I believe it might have been Manager Oliver, or maybe it was Manager Jones. I'm not quite sure who it was. But in terms of total numbers, I think it was Manager Jones, now that I think about it. Total number of individuals served through Hancock, you can see we've seen almost 3,200 unique individuals through that site. And we've tested 2,147 unique individuals. What's important to note is you're looking at data that's through yesterday afternoon. Our teams are getting us data in near real time, and so we're able to go ahead and do surveillance in terms of what we're seeing in near real time. And there's a lot of effort behind this to get the data to be able to present to you and to the community at large and to our own board of directors here at CommuniCare. But we think it's critically important for us to have as near real-time data to be able to look at it from a surveillance perspective. Of note, our Hancock site has served a disproportionate amount of individuals who are non-community care patients historically. Almost 62 to 63% of the folks through that Hancock drive-through site are not community care patients. Unlike our Eastern Crescent sites, they tend to be a vast majority of folks are actually either directly within the communities, like for example, Austin's Colony, Hornsby Bend, 78724, 78725, and also community care patients. So one of the things that we did that's a little bit different based on some feedback at our community update yesterday, we're doing bi-weekly community updates from noon to 12:30 on Tuesdays and Thursdays in English, and then in Spanish from 12:30 to 1. We actually did a trend analysis, and this goes for all the tests that we've done, and we've conducted almost 3,500 tests to date. This is a breakout based on age. So less than 17 years of age, 18 to 64, and then above 65. And what you can see is the vast majority of tests are in the middle here, the 18 to 64 group, and we have a positivity rate of 17.4%. That's a high positivity rate compared to the community at large, right? It just means that we've been very discerning in terms of how we use those tests, and that folks who are coming to our various different testing sites and or in our clinic, because we're testing in our clinic as well, have actually gone ahead and come in seeking tests because they're symptomatic. What was surprising is just the fact that we have a 12.4% positivity rate in the children that we've actually gone ahead and tested, less than 17 years of age. A positive note, the positivity rate is very low, much lower in our aged population, those over the age of 65, which indicates that folks who are seeking tests that are coming in of concern relative to potentially having coronavirus or COVID-19, it may indicate that cocooning or isolation and social distancing for older population is being effective, and that may be one of the explanations. So when we take a look, over 3,000, and I'm just pointing here up at the top, 3,000 tests overall have been provided through our various different initiatives, including, and our overall positivity rate right now is 16.62%. It's down a little bit from late last week when it was 16.64. So looking at this is positivity rate by race. And so again, this is all tests that we've done to date. And so when you take a look at this, we can see that overall our African American population is sitting at 7.59%. Very small sample size relative to our native Hawaiian Pacific Islanders at 18.75%, with only 19 tests overall having been performed. And when we take a look, or 16 tests, I should say. And then when we take a look at our whites, including Latinos, our Latinx, we're at 18.58%. And then when we exclude Latinos from the white race, as it relates to reporting and self-identification, that drops down to 7.81%. What I think is going to be of very keen interest to the Board of Managers this evening and community members who might be listening in, is the trend analysis that we've done week over week that I'll get to in just a moment or two. So positivity rate by ethnicity. So you're going to see that this has grown since last week. Last week when we shared this with you, it was about 23.02% for our Latinx population. It is now at 24.5%. You can see we're doing a lot of testing within our Latino or Latinx population, and you can see our non-Latinx population is at 7.17%. And so when we take a look at this, one of the things to note is that early last week, our Hancock drive-through site had a significant referral from a construction company located in Round Rock who had a known case. And so they actually sent some of their workers down to our site to get tested. Last update I had is that 17 of those individuals tested last week tested positive. And so this is skewing a little bit because we've got folks who aren't just randomly coming in, but now we've got employers who are sending folks to us, which is more than fine. That's what we're there to do, right? But with that stated, I just want to acknowledge that part of what's going on with last week's results is that we do have some industry that's referring directly to us, given concerns at their work sites. So positivity rate by community care patient. I also want to point this out. So right now, to date, out of the 3,050 tests that we've conducted, we've gotten 2,702 tests back. So that means we have 332 tests still pending. But the turnaround time is improving with our reference labs. It's on average now less than 3 days from the test being conducted to the test results coming back. So that's a very positive development. We're also tracking, when tests are coming back and how many we have outstanding by day right now. So if we tested last week and we tested 140 people in a day, we know that last Monday that we still have 30 tests that are outstanding. So what this demonstrates, though, of all the tests that we've conducted, 55.5% have been for non-community care patients. So they're going to the community at large. So a majority of our tests are directed at the community at large. And one might ask, well, hang on, you're a health center. Why are you testing so many folks that aren't your patients? Well, because with you as our partners, we made a commitment to making sure that all within our community had access to tests, not just those that are our patients. And I think you're going to recognize in a moment or two just how important that decision was, especially where we are now. So the other is to note that the non-community care patients are actually testing on average at 17.93% versus community care patients coming in at a little less than 15%. So that demonstrates that testing non-community care patients who might not have access to a doctor or have access to testing is critically important. So proceeding to positivity rate by ethnicity and by community care patient status. And so we broke this out, given how high our Latinx population positivity rate, over 24% in aggregate, we wanted to break this out also by non-community care patient versus community care patients. And this is where, for example, the construction workers I just mentioned a moment ago are going to have an impact. And so when we take a look at community care patients, our Latinx population is coming in at 21.5%, rounding up a little bit. And then our non-community care patients that are self-identified as Latinx are coming in at almost 28%. And you can see how it drops off. Again, this is for all the tests that we've done since the middle of March through yesterday. And not all of the results, of course, have come back yesterday. It's one of the reasons when we get to trending, you'll see we cut the points for the week-by-week trend. We cut it off by the end of last week, just simply because tests are still trickling in as this week progresses. So with that stated, what does our positivity trend look week by week? And so this should catch your attention very quickly, right? You can see mid-March, we started testing a little bit before, but there weren't significant volumes, so we've just removed that. We're really talking less than 10 tests total. So you can see the trend line indicated for positivity rate in red here, and you can see an upward trend. And so we went from a low from March 15th through March 21st at 8.96% to now a high from last week of 21.16%. So what does this mean? before answering that question, I also want to point out that when you take a look at the total number of tests, so you're going to have to add in this one, you have to add the negative to positive, the detected or positives to get the total number. But you can very clearly see based on the bar graphs right here and here that our testing is increased very significantly over time. And so anyone who's coming in and presenting with symptoms right now, we're testing. So it means that we're capturing more folks potentially who are positive as well. Whereas before, if you weren't in a high risk group and you came in with symptoms, we were telling you to go home and self-isolate. And that would be in mid-March to late March when we had access to limited testing. And so very, very well, we were sending folks home that would have otherwise tested positive, but we just didn't have testing supplies. So it's important to recognize that. This rate could have been much higher had we been testing more folks at that point in time. And it could be an artifact of the fact that we had limited testing in March. Notice how I'm saying could and might, because a lot of this is not, there's no way for us to know definitively, right? The other thing that's very clear to point out, like we did last week, is the fact is that this is only representative of the folks that we've tested, right? It's not representative of what's going on within the community at large, but it is statistically significant given the number of tests we're conducting and the folks who are seeking care within our environment. And so I don't want to minimize the fact that there's a trend here. This trend is important for us to recognize, and it actually should inform our initiatives moving forward, and I can assure you most definitely will. So when we take a look at positivity rate trended for Latinx by week, so you can see previous slide here, in aggregate 21.16% last week. We had a jump in our Latinx population. This first time we're sharing this data publicly, by the way. You can see a jump to 31.32% for our Latinx population tested last week. And again, part of this number jumped because we had construction workers, many of whom were Latino, who came in and got tested last week. But again, doesn't account for the 109 individuals who tested positive, but rather only 17 of those 109. So there's a trend going on here within our Latino or Latinx population, guys. So you look back mid-March, it was at 0%. Again, very low testing overall. We've increased testing. This also speaks to the need for us to test more, right? And we're committed to do that here at Community Care, as is Austin Public Health, as is any major healthcare provider, well, not any major, all healthcare providers. So what does it look like for African Americans? You're going to see a very different trend now for African Americans. We're actually seeing that we had a high for those that we were testing back in the week of March 29th through April 4th. And we've actually seen for those that we've tested, again, this doesn't necessarily indicate burden of disease of coronavirus or COVID-19 within our African American neighbors, but rather just within our testing in the group of folks that we've tested. But as we've increased testing within the African American community that saw testing within our testing sites or within our clinic, we've actually seen a decrease in the number of folks who are testing positive, who self-identify as African American, all ethnicities included within that. So that would also include folks who are Afro-Latino as well. So you can see last week it came at 3.64%. And so there's a drop there. That stated, we would not see that this is statistically significant because of on a week-by-week basis, we're not really hitting a number of tests where you can draw conclusions. Now in aggregate, when we look in aggregate, you can start drawing some conclusions, right? And we're using a sample size typically when you're looking at cohort of at least greater than 70. And so we didn't reach 70 last week. That's why I'm saying we're not willing to draw statistical conclusions from this at this point in time. But again, it's a trend. And so take it for what it's worth, please, Board of Managers. So what about positivity rate for trended over time for white only? And so very similar to our African American population, we had a high much earlier in March than even for our African American population, which was towards the end of the month of March. In mid-March is when we saw our high in terms of percentages. And then we started to see it drop and then kind of popped again back from April 5th through April 11th. And then you've seen it kind of plateau, sitting in the 4% range. There's sufficient sampling here as it relates to testing within whites only that I think we can draw some conclusions from, at least for those that we've tested. And I can't say that enough because this is only our testing sample that this is representative of. But these are, again, folks who are coming to us, right? Seeking testing with symptoms, and that's how we're still testing. And so what does this look like then when we skew this relative to, or trend this relative to week over week for community care versus non-community care patients? Actually, what we're seeing is the trend is flattened for us and actually lowered recently for community care patients, but is increased for non-community care patients. And this is where workforces that are coming into our Hancock testing site are going to skew this. Again, another very good reason for why us providing testing at large within the community becomes extremely important. Because as soon as we test someone positive, we get that result back, APH gets the positive rate, and our teams who are helping with contact tracing in partnership with UT, UT Health Austin, in terms of some of the delegated tracing initiatives, contact tracing initiatives we have with APH, I kick into gear and then go ahead and do that contact tracing. So overall, what does this mean from community care's perspective? I think from our perspective, we have a very strong desire to go ahead and continue to increase our testing. I'm very pleased to inform the Board of Managers, and we'll be updating our executive committee of our Board of Directors on Friday, noting that some of them may be on the line this evening. With that stated, we're working right now to bring additional testing into community care setting. And we think we're going to be able to secure upwards of several hundreds of tests more a day. And so Yvonne and our Chief Medical Officer, Dr. Ellen Schulsha, and others are working on a strategy on how best to use those tests. What's of a significant note is the teams are working on not only in the partners that we have, and I can provide the update next week once we've got it more formalized. I have a conversation on Friday with these national partners about how we're going to bring this into our community, but we're going to be one of 10 community health centers across the country that are going to be doing this. We've got a commitment from those partners that they don't care if it's their patient or a covered member. So I'm alluding to the fact that it's in partnership with a major healthcare insurer and with a major reference lab. And the lab is Quest Diagnostics. I can indicate that because we already have a partnership with them. But with that stated, not only are we going to be able to use the test not only for our patients, but also for community care at large and for anyone who seeks testing. The other unique thing is that we're going to be allowed to use this for asymptomatic testing, which we're not doing right now. And if you're aware of the change in guidance earlier this week for CDC, it aligns with who we're charged with here at Community Care as both a health center and as a partner to Central Health to make sure that resources are brought to bear to under-resourced communities, and in particular to individuals who are lower income and who are drawn from racial and ethnic minority groups. And CDC's guidelines placed as a high priority earlier this week asymptomatic testing for individuals who are racial and ethnic minority groups. And so we're putting together a plan to increase our testing. I'm going to be honest with you. We're going to look first and foremost to do that within our own clinics to start, but then also with a commitment to looking at how do we do targeted asymptomatic testing and symptomatic testing within our harder to reach communities. And so you guys know those communities already. It's the places where we're doing our Eastern Travis County testing, and also looking at ways to increase in Dove Springs and in Pflugerville. So the team's putting that together. So, Yvonne's going to kick me later, perhaps, relative to a little overshare there, but I tend to be very transparent and think this is important. So We're not announcing the initiative tonight, but we're informing that we're working very much on an initiative to increase this with more to come. With that stated, that concludes CommuniCare's update this evening, and look forward to answering any questions the Board of Managers may have when appropriate, Manager Greenberg, Chairperson Greenberg.
Thank you. Are there any other updates at this time?
None left. Thank you.
Okay, if there are no other updates at this time, thank you all so much. Community Care, I cannot say enough about all of the work that you are doing for our patients and for our community. And of course, knowing the incidence of the disease, having more testing and contact tracing is important to everyone's health. We thank you for all that you are doing, for all the staff of Community Care. I know they can't all hear us, so would you thank them for us, please? To all the other presenters, thank you for all of your hard work and for the valuable information that you have provided tonight. Members, we have about a little less than 20 minutes before we probably lose a quorum, so let's be concise with any questions, and we'll open it up to questions now. If we can, I can't see all the members yet. Let's see if we can switch to that view. Maybe quit sharing your screen, I think, and we can get back to the view where I can see everyone.
Madam Chair?
Yes, I can't see everybody yet, so yes. Yes, Manager Valadez, I hear you. Please, go ahead.
Okay, I'm going to start with Jason and go backwards because it's not going to be very extensive. Jason, you can't know how much of a hero I think you and all your staff and everybody with Central Health and the Enterprise and all the people that are working so diligently to help deal with this health crisis. First and foremost, with respect to the Latino population and the testing that has been going on, I have been hearing from a lot of people in the Runberg area more than any other area where I have contacts, which I have in all over the place, and they are really sick. They are not taking the bus. They are not going to Hancock because that's the closest place that they can get tested, and they need a mobile unit or they need one of your clinics to open up in Runberg so that they can get there. They do not want to ride the bus.
Manager,
Okay?
is there another question, or if not, we'll let Jason answer that because we're short on time.
Yes, no, that for him, that'll be it. And
Okay,
then I'm going to
Jason,
ask one more thing.
Yeah, so Manager Valdez, as it relates to Runberg, our Runberg Health Center is open and we're testing there on site. So part of our plan will be, as we start looking at ramping up testing with this new initiative, that will be spread to some of our larger health centers. And Yvonne, I have to imagine Runberg's in the mix for that, correct? Yes, it is. So, you know, staff are giving me an update in the morning relative to planning. And so I don't want to get too far ahead of them and not commit, but we're going to end up increasing testing at that site. So
Jason, can I ask you a favor? Can you quit sharing your screen? I think if you do that, I'll be able to see all the members.
I apologize, Manager.
That's okay. It's a little difficult for me to see everyone. Let me see if that fixes that problem. We're still seeing your screen. Yes, thank you so much. Okay, Manager Valdez, did you have another quick question?
Just another quick question for just Yvonne. I guess it's Ted. Real quickly, you said 104.2. Is it 104.2 or 104.3 on the radio station that you're hitting up for CSAs?
It's KLQB.
Okay.
Manager Jones, yes, do you have a quick question?
Yes, first of all, thanks very much, Jason. That was an excellent report. I really appreciate it. I would be interested if next time, if you could do a percentage of the population that have been tested based upon race and ethnicity to the total population to see how that looks, how that would reflect those that are coming back positive. Tested. So we get a percentage of that by race and ethnicity. So for our next report, if you could do that. The second thing is for Ted. were you able to include other African American stations? I didn't see any mentioned in that in terms of your outreach efforts. You said focus primarily on the Latino population, which, you know, I certainly agree with, but I didn't hear any African American station.
Thank you. Okay, Jason, that is an important statistic, Manager Jones. Is that something, though, that your staff could do without undue burden, Jason?
We'll make sure that we have that next time we're presenting to the board of managers. Absolutely, no problem.
Thank you. Appreciate it. Ted, could you address the other question, please?
Yeah, and so back on the screen, the two stations that we purchased in English were KKMJ, which is 95.9, which is an R&B station, and then Magic 95.5. So those were the stations that we purchased, and of course we also have our partnership with KAZI.
Right.
And you're using that. Okay. All right then.
Thank you. Any other questions? I see Manager Musaitov. If you have a quick question.
Yes. Well, good evening. First of all, I want to thank all the nurses, especially our community care nurses, for all their efforts and work, given today is National Nurses Day. Thank you for your compassion and bravery, and especially during these hard times. And thank you, Ivana. One of the couple questions really quick. As we're loosening our social distancing and the governor's orders to expand dental services, and what is community care doing in that respect? I know that you have closed your dental services that you're providing. And also, are you also, to what capacity are you opening the clinics, given that we also have other chronic issues happening with our community as well in terms of primary care prevention?
Thank you, Manager. So there are two questions for community care.
Thank you.
Yeah, so I'll go ahead and just start with the dental services. So for clarity, the only dental site that is offline right now is our Ben White site. Our sites, the remainder of the 4 dental sites that we have all been online and providing acute dental services. We have not, given the governor's order back in March, where we had to postpone elective services. We're now in the midst and are planning to bring our elective dental services back into play on Monday, May 11th, next Monday. It is going to be at 25% capacity. And part of that's just based on the physical layouts. These are aerosolized procedures, so we have to make sure we're taking extraordinary precautions for patients. We're able to do that because we have adequate PPE. One of the things that we've taken a look at is an inventory as it relates to our personal protective equipment to make sure that we've got sufficient personal protective equipment, and we're in a good place to be able to ramp back up dental services. As I previously communicated, or we previously communicated to the Board of Managers, dental does go through PPE fairly quickly. As it relates to medical sites, our medical sites have been, the vast majority have been open throughout the entire pandemic time period. We did have some temporary closures as related to Del Valle, Hornsby Bend, Manor. They're back online, have been back online now for two plus weeks. The only sites that remain closed right now are our Austin OBGYN clinics, our Springdale location, as well as our Riverside location and our Manor location. And that's simply because we needed to make sure that our prenatal population was protected. And so those sites are going to remain offline for the foreseeable future. We've concentrated our women's health services, prenatal services at our East Austin clinic and at our North Central clinic, and really kept that population away from any other populations being served. The other part of your question was, as we start ramping service back up now that things are opening up, we're in the midst right now through our rapid response team investigating what that looks like, but we've been doing that in a phased approach for the last several weeks. We started first with pediatric care and well pediatric care, and started with less than 2-year-olds coming back in for well child checks, and then went up to 5 years of age, then up to, I think, 8 or 9. And then kept on phasing that in and through. And so we've been responding to that. We've been able to do that by having sick kid care in the afternoon at several of our locations and well care in the morning. following social distancing as well. So we have an analysis going on in terms of what does a safe environment need to be moving forward as patients start demanding, wanting to come back in. We are right now still utilizing our telephonic and telemedicine as the first option whenever feasible, but we're also looking at our preventative services, mammography, other things, iris, which is retinal screenings, retinal eye exam screenings, coming back online and bringing folks back in. And so the teams are working on that right now.
Thank you very much, Jason. Are there managers? Does anyone else have any questions?
I would like to make one quick comment. If we have a meeting next week, it would be helpful if we could have these submitted in advance so that they do not have to necessarily walk through them with us if possible, and that we could at least be able to ascertain our questions prior so that we have a little more time to discuss it. Because I think 15 to 20 minutes for a discussion is not adequate. I appreciate it, but it's not adequate.
Thank you. Yes, we're just in a situation where I think we're going to lose a quorum this evening, so beyond our control. Managers, any other questions at this time from anyone? I'm looking. If you have one and I can't see you on the screen and you haven't spoken yet, Manager Oliver or Manager Bell, or am I missing anyone else? Manager Bell is saying he's fine. Manager Oliver, you're fine. Dr. Zamora, Manager Zamora, do you have anything? Any questions? Not
Just
seeing.
one question, Chair.
No questions?
When are we going to change over to IgG, IgM testing? That's much quicker. I know it's all emergency use only, but I'd like to see that because we can get the patients the results faster.
Jason, can you address if there's a possibility? I know we're getting more testing, but what kind? And if it could be that rapid testing that Manager Zamora had just alluded to as a physician.
Yeah, great question, Dr. Zamora. So the Abbott rapid test is really only available to folks who had, or organizations that have had either an existing relationship with Abbott and or have units that could be deployed. And we unfortunately did not. So we do have our lab director looking at that, but we believe it's going to be several months before we end up with that Abbott PCR test being available to us. We are also looking at other alternatives, but nothing else has surfaced yet that I'm aware of, Dr. Zamora.
Thank you, Jason.
Yeah,
Thank you, Jason.
Chair, you're on mute.
Thank you. Anything else, managers? I'm looking to see if anyone else has a question that we have not addressed yet. Anything else?
I just have a quick question. So are we going to consider a meeting for next week?
We don't have anything posted on that.
Chair?
Yes.
I have a quick question. Do we have the number of our patients' hospitalizations?
Jason, can you address number of hospitalizations? I know that there's a lot of modeling going on with
for community care patients.
Jason, I know there's a lot of modeling going on hospitalizations, and maybe John Morgan, you can address this, but I don't know if we have the community care level. Does somebody have that information?
We don't have available this evening, but we can follow up with that. And I think Manager Youssef, you'd asked for that last week, and I apologize, we did not. We need to follow up on that question from last week. So sorry about that.
No worries, thank you.
Okay.
So Manager, Chairperson, so are we going to meet, are you saying we're not meeting next week?
We don't have that posted as agenda item. Holly, can I speak to that?
John is going to say something, Morgan.
Yes, but let me ask, I understand, Holly.
I've asked a question first. I appreciate it.
Yes, I know.
Thank you.
That's not a posted item. I'm asking council if I can speak to that.
So typically what we can do is speak to when an item will be on the agenda, but right now I wouldn't say we're posted to talk about the next regularly called meeting.
Okay, so apparently I cannot speak to that. Manager Jones, I'm sure we can talk later, but apparently it's not a posted item on this agenda, so I can't speak to it. John Morgan, did you have something you wanted to add to the discussion?
Yes, ma'am. Just to add to Jason's comment, we have requested additional data on hospitalizations. We're trying to get that data through both the city and directly from the hospitals. What's been prioritized is data sharing specifically around treatment, followed by contact tracing, and then more broad data sharing for analytics and future planning purposes. So we are still pursuing all three of those.
Thank you. Appreciate it. Anyone else have any questions that I'm missing? I'm trying to view the screen here. I'm not seeing any, but if I'm missing you.
I know we cannot speak to that. But my question is, so is our next meeting at our regularly scheduled meeting? Is that my understanding?
I don't know if I can speak to that. Let me ask counsel.
So I think you could say when the next regularly scheduled meeting is.
Okay. Apparently,
that's what my question was. Is it the next regularly scheduled meeting?
I can speak to the fact that we have a regularly scheduled meeting of the Board of Managers on May 27th. Is that correct, Holly?
Yes.
So I can speak to that. Okay. Thank you. Any other questions? Okay. Well, with that, is there a motion for adjournment? I see Manager Valadez. Do you want to make the motion? You're on mute.
I want to thank everybody for their presence, and I move to adjourn.
I'll second.
So there's a motion by Manager Valadez, a second by Manager Musaitiv. All in favor, say aye. Aye. Opposed, same sign. Any abstaining? Thank you to everyone, to all of the board members, to all of the staff, to all of the public. Thank you very much. And we appreciate your participation, and we appreciate all the updates and hard work of everyone, including, as Manager Musaitiv said, all of the nurses recognized on Nurses Day. Thank you, everyone. Good evening.
Thank you. Bye.
Bye-bye.
Thank you, members.